Hello and welcome. Welcome to the Nuffield Trust Summit. And this is the session, Guided by the Evidence, Informing Future Health Policy. Wait a minute. Evidence? Wait a minute, evidence? Being guided by evidence? Wait a minute. Being guided by evidence to inform health policy? I feel like this is like Hollywood. It's surreal. I can't believe it's actually true. We would really do that? Monsters, Inc., Toy Story, Frozen. In the book Creativity, Inc. by Ed Catmull, the founder of Pixar, he refers to the power of story. Power of story to get people to be motivated, to understand new ideas, to imagine the future, to get them to act. And we've heard about how the 21st century is going to be the era of the storyteller. People as diverse as Steve Jobs has said the future belongs to the storyteller. Yuval Noah Harari, the great thinker of the book Sapiens and Homo Deus, says that we need a new story, that the story of the 20th century was liberalism. Well, that was actually the 19th century, but go with it. That the 20th century was capitalism versus communism, but the 21st century doesn't have a story, and we need a new story for it. And of course, I'm a journalist, so I'm all in on stories. I love the idea of the storyteller because it sort of is self-promotional. And in the era of today's politics and how it's had to try to work with and interact with and understand and respond to COVID-19, we had on one side the 20th century technocrat whose face was shoved into the mud, and we had the 21st century populist who seemed to have simple answers to all the problems, and when COVID hit, adopted that same sort of policy. So I'm struck with this idea of how do we use evidence and think about evidence in society, and how do we start with the idea of the human consumption with it? I'm going to introduce our panelists today first, and then I'm going to prod them with one single question in which I want a one-word answer to get us started, to crystallize this debate, and then we're off and running to try to understand this issue of being guided by the evidence to inform future health policy. Luckily, we've got some remarkable speakers today. The first one is Professor Ashish Jha, who's the Dean of the School of Public Health and the Professor of Health Services and Policy at Brown University. The second is Dr. Alex Freeman, the Executive Director of the Winton Center for Risk and Evidence Communication at the University of Cambridge. Now, sadly, Right Honorable Jeremy Hunt is unable to attend today's session, but the good news is that Nigel Edwards, the Chief Executive of Nuffield Trust, has walked into his, or strode into his chair to actually help us understand these issues. And with us also is Mark Dyan, who's a program lead at the Nuffield Trust, and he'll help us moderate questions. So if you have questions, put it into the chat, and we're going to go to it so that we can make it as interactive as we possibly can, even though we're all in lockdown in our remote areas, talking through a network. My question is this: what is more important for health policy, the expert or the storyteller? I want a one-word answer from each of the panelists right now. Is it the expert or the storyteller? Who's more important, or what is more important for health policy? And why don't we start with Ashish Jha, please?
Sorry, so the storyteller clearly is. Of course, what I want to say is the
Stop. We're going to next go to Alex.
Expert.
Ooh, okay, Nigel.
I'm with Ashish. I think the storytellers now, maybe not in the past.
So 2 against 1. Alex, how did you get it so wrong? Wait a minute, hold on a second. Wait a minute, maybe it's a gender thing. 2 X's in the chromosome, X versus Y. Okay, Ashish, you were off and running with an explanation. Why don't you tell us why you chose your particular side?
Yeah, so as a classic academic, I was trying to hedge. But if you push me, and you did, to pick one, it's the storyteller. And but what I wanted to say was that the ideal would be the expert storyteller, the person who understands the data and the evidence and can translate it into a story that people can understand and relate to. And I often, like in the US, we've had this very vigorous debate about how our healthcare system is structured and what we should be doing. And we often look to places like the UK and say, why don't we just do what they do? And it has come back to me kind of over and over again. There's a line from Uwe Reinhardt, who was a very famous economist, and I'll just tell you this quick story and then I'll stop, is, somebody was asking him about Denmark, because Bernie Sanders, running for president, kept talking about how wonderful Denmark is. And Nigel has heard me tell this story. But so Uwe Reinhardt was asked about Denmark and whether America should adopt the Danish health system. And Uwe said, Denmark is wonderful. Denmark is great. I will take the Danish health system. But you must also give me the Danish political system. And it would surely help if you gave me the Danish people. And his point was that health systems, evidence, policies can't be divorced from not just the governments that govern those things, but from the stories people tell themselves about why these things exist. The stories that people in the UK tell themselves about the National Health Service is unlike stories that Americans tell themselves about Medicare or our healthcare system. And if you don't understand those stories, you can't really, the evidence bounces off. It doesn't work, it doesn't stick, it doesn't move the needle on where things need to go. So at the end of the day, to me, it's all about stories. And then it's how do you shape evidence into those stories.
Great. So the Danes have their facts, the British have their facts, and the Americans have their facts, and all these facts are different. So there's no such thing as facts. There's only storytellers that are molding these facts. I'm characterizing, a caricature of your view. I'm not really saying adequately representing your view. But Alex, you believe that this is really quaint. This is like brainy Smurf.
Yeah.
The great age of the technocrat. Please tell me, why do you think that the expert still is?
Okay, so I think, for 17 years, I was a filmmaker for the BBC. So my background is in stories. Stories are king, as you say, in the entertainment industries. And I used to think that in my storytelling, I was informing. Our motto was to inform and entertain and educate. And I thought that I was doing balanced storytelling and that this was a good way to communicate. And of course it is. It's very engaging. You can engage people's emotions. But when I started this job in Cambridge and I really started thinking, our motto at the Winton Centre is to inform and not persuade. And I started realizing that everything I was doing when I thought I was informing through my storytelling was actually persuasive. I was controlling people's emotions. I was controlling how they would react to the information I was giving them. And I wanted them to believe a certain thing. By the end of it, I was guiding people to an end point that I already had in mind as the filmmaker, through music, through language, through images. And I've realized that actually, although I completely agree that we as human beings react to stories in a very powerful way, but that is a very persuasive and dangerous tool. And communicators, I think, are only just beginning to realize, maybe it's just me, maybe I'm really behind the curve, but I think there are toolkits about communication that are about persuasive communication. And there's a whole different toolkit if you're wanting to inform people and support them to make their own decisions. And I think that that second toolkit is one that we're only just discovering. When I talk to people who are, communicating to people who they shouldn't be persuading, so doctors talking to patients, they shouldn't be persuading them, they should be allowing them to decide. Talking to policymakers, again, civil servants should be allowing the policymakers to decide. And when I talk to them about this difference and about the different techniques that you can use in your communication if you're doing these two different things, they're realizing that, this is not a difference that we had previously really thought about, and that all the techniques that you're taught as a science communicator, all of that comes out of the persuasion toolkit. And I think the future will be seeing these two forms of communication quite differently and supporting people to make decisions more than persuading them.
Uh-oh, I'm really nervous that you're sort of taking a middle position. I tried to sharpen the debate into the extremes. Nigel, you're not allowed to play this Goldilocks role of saying it's a little of one, a little of the other. You have said that it's the storyteller. Justify your very risky answer.
Thank you. Yeah, I would build on something that Ashish has been saying, but bring in another problem, which is the problem of complexity. And one of the reasons that storytelling seems to win, if we're opposing it to expert views, is it is dealing with the problem of complexity, often by ignoring it, or by creating a false simplicity that is very attractive. I think people find complexity quite anxiety provoking, and we don't like anxiety. We tend to be averse to it. We also like structure, and much of the complex expert opinion that we have may not be as well structured. It doesn't create a feeling of coherence. It doesn't feel right to the recipient, and complexity is really hard, and it often, as a consequence, when you explore the issues you explore complex issues, you don't get nice easy answers coming out at the end of your equation. You get difficult trade-offs, and that's where we've run into difficulties with the pandemic, because the science has actually produced a set of, well, on the one hand this and on the other hand that, and it now comes down to issues about your judgment, your values, what you think the population think about what you're saying. It's, as we heard yesterday in our debate, it's probably also mediated through a whole set of cognitive biases that people will probably bring to this as well, which are more likely to apply, because when we're confronted with complexity, we run heuristics, we do shortcuts to try and navigate our way through it. The storyteller solved many of those problems for us. It may not be the right thing, but it's certainly something that's a very powerful part of the conversation.
Okay, let me put the idea of cognitive biases and ideology to one side and dig a little bit deeper into this idea of complexity, because the issue of complexity is actually neutral or separate from the question of the expert or the storyteller. And the reason why is that both can look at complexity and they have to make a decision how they communicate that complexity. And the perception, I'll call it, let me be sort of mischievous and maybe also revanchist and say the 20th century view of complexity was to neuter it, was to sand it down. Journalism was intended to do that. As a young journalist, I was told you should write to the 8th grade level, so the sort of maybe the if you will, the teenager level. And of course, Time magazine and Newsweek magazine was all about creating this bland, milquetoast sort of drivel of journalism that didn't actually deal with complexity. In fact, it was the British media, interestingly, that was considered the ones like the Economist, that was and the Times of London and the BBC, that was more depthful, that handled complexity. And I wonder, and I think the 21st century has been one with social media where you have experts who are talking to people. It seems like there's a real push that people can handle complexity better than before. At least we're treating people more like adults. Yet at the same time, there's decision makers and politicians who have to look at the complexity, and it looks to me that they're saying with COVID-19 that the public couldn't handle complexity. That in fact, they had to give a message, if you will, a story to people that was simplified, in some cases overly simplified. Do you feel that was intention, and that we made, and how do you think we made that decision? Did we deal with complexity correctly, or did we oversimplify it to a degree that was actually misleading and wrong for the objectives that we had tried to attain?
I think there's a lot of I think there's been a lot of people being quite patronizing about the public and what the public can understand, and a lot about, we'll make the decisions and then make the rules and then tell people what to do without trusting people to make their own decisions. And I think that is an old-fashioned way of thinking, that we've often lived in a society where it's quite paternalistic, especially in medicine, but also in politics. And I think we're moving to a much more a future where people are much more independently minded and able to make up their own minds, and they want the evidence and the information to be able to inform those decisions. And I think that's a situation that politics hasn't always caught up with, because it's quite fast moving and politics is quite slow moving.
So can I agree quite wholeheartedly and build on this a little bit? And as Nigel was starting to speak, and Kenneth, as you were, I couldn't help but think about the old H.L. Mencken
line for every complex problem, there is an answer that is clear, simple, and wrong. And you know, what I have come to believe in this pandemic, and I've learned a lot, and I mean, we all have in this pandemic, about how our societies work, how communication works. One of them is that the desire for simplification exists both among experts and storytellers. And really good storytellers know how to tell complex stories, and really good experts know how to talk about complexity. And we've seen a proliferation of simplification from both sides. And that's why I think that interesting divide that you started us with doesn't get us out of this problem. And I have been, in the last month, it's been really interesting. For the first time, I've actually started getting pushback from a lot of my public health colleagues. I've been out there very public, very communicating a lot about the pandemic. And last year was easy because my opponent beyond the virus was Donald Trump. And Donald Trump was such a, like, this phenomenal source of misinformation, junk information, distractions, that pushing back against all of that was really easy, right? Just, it was really not that hard. This year, it's gotten meaningfully harder because we have a president that's more nuanced. We have policy that's much more effective, better. And what has been interesting is I have been trying to explain to folks about where I think the pandemic is going. And it's nuanced, it's complicated. People are gonna have to start making decisions. Things are gonna get better. We're gonna get vaccinated. What is safe to do is gonna vary from person to person. There isn't, and when I talk about those things, a lot of people in public health say, people can't handle all that complexity. Just tell them what is safe to do. And I think people make decisions every day about what is safe and not safe, every day. And so there are a lot of experts who want to simplify things. And I think it's wrong. I think it's unhelpful. And I think it will undermine the credibility of experts every bit as much as I think it will impact storytellers.
Nigel, I see you nodding. Do you want to weigh in on this, or should I drop the M-bomb?
I've not much to add to that analysis. I entirely agree with it. Although, you know, the growth in false information, interesting to the extent to which President Trump represents the outcropping of a wider societal trend rather than being a one-man engine for this. It is very noticeable that how much the pandemic seems to have created, you know, very compelling stories which are demonstrably wrong, and sometimes amongst actually senior academics in institutions where you wouldn't expect that to be the case. And I think that's another phenomenon here that muddies the water further. But don't let me stop you from moving on. But
let me pick up on that because there's more to it. When you refer to sort of institutions and people that you wouldn't, and experts that you wouldn't expect to be the ones to be spreading misinformation, what do you have in mind when you say that?
Well, there's a range. So there's a number of very prominent people on Twitter with very large numbers of followers, including some people with some quite heavy scientific credentials who've worked for big pharma companies, who are people with medical qualifications, who are putting out stuff which is demonstrably wrong, often misleading. And indeed, I think there's been cases where some of these academics in the UK have got access to number 10 and have provided advice which has been not quite as extremely wrong as that, but certainly orthogonal, you might say, to that of many of their colleagues. And it's, I mean, a degree of disagreement amongst academics is to be expected. But I think some of the level of divergence has been surprising, and then it's sort of intersected with a willingness of the policymakers and the politicians to hear that point of view. So it's become legitimized and perhaps become more accepted than it would have been in normal, more calm times, where those sorts of opinions would have been subject to the normal peer review process. They wouldn't have been publishing things and putting them out on Twitter without that. The whole preprint environment that we've seen develop has certainly helped to that. So some of the checks and balances that were in the system, because it's fine for academics to be wrong. That's partly how science moves, right? The problem is that normally, in normal times, there's a bit more of a check and a balance on whether or not those opinions get put into the mix.
Well, in normal times, well, as it were, we had when you say normal times, what you're referring to is pre-social media, pre-internet, when we had a handful of identifiable journalists who could, at the sound of a whistle, could be called in to a ministry or to number 10, and the press secretary can tell them something. They typically didn't know what they were writing about because they were generalists, they were not specialists, and they would parrot it very dutifully. And as long as they didn't misquote the person, that they could actually be a very good stenographer. And then it would be blasted through the Daily Mail and be blasted through the Daily Telegraph. The world was admirably arranged. And if you catch that between 5 and 25 journalists who would cover this particular area, you can communicate your message. In a world of social media, those gatekeepers are gone. And the benefit here now is that you don't have to wait for the Oxford Dawn to sort of tell you what to do. The Oxford Dawn has her own sort of broadcast bullhorn on Twitter and can actually tell everyone about her great declaration. So what's better? The world of the god of small things, where you have a handful of journalists who can be manipulated by people who should know best, or a disaggregated, decentralized world in which the experts themselves, even if they disagree with one another, can actually communicate publicly independently.
I mean, they've both got pros and cons, and I don't think we're in a place to decide because we've got the second world. But what I think it does is it destroys the heuristics that we'd developed over the previous decade. So you used to probably end up going, are they from a reputable institution? You know, have I previously believed their opinions? Then that influences how I'll accept the information they're giving me. And I think we're now in a world where we have to look more closely at the information itself and less on who's giving it to us, because we might not know who's actually giving it to us. We might not know, you know, their identity might not be what it appears to be. So I think people have got to get better at judging information on its own terms and not using information about the provider or the communicator as a shortcut to whether they believe the information themselves. And I think that's a very different world. And I think it's one in which we have to learn a whole lot of new ways of looking at information and judging it.
So I think we're in a transition phase, right? The old world that you described, Kenneth, is gone. Like, it's just gone. And probably good riddance. Like, I'm not sure has always served us well. It certainly has perpetuated a lot of problems, has kept a lot of voices out of the national and international conversation. And I'm not going to miss that world so much. The current world is unsustainable in some ways. And I'll try to explain. And then we have to transition to a new one, which I have to say I struggle with. What will it look like? But to Alex's point of having to judge the information itself, absolutely, but it's really complicated, because when I think about the pandemic, for instance, I do a lot of communicating. I'm on TV a lot. I talk about very complex things, including things that are a little bit out of my area of expertise. So for instance, a new study comes out on what's happening with T cells 6 months after an infection. There's a lot of complex immunology that goes into talking about T cells. I feel relatively comfortable, but it's a little over my head. So a lot of what I do is curate the best immunologists. So if you want to talk about immunology, I will trust Akiko Iwasaki at Yale because she's as good as they get. But I know that. And in some ways, you have to trust that I am curating effectively. And you can't use the institution. I just mentioned that she's at Yale. She could be wherever. Institution as a curation tool is going away. And so now we're getting to a point where I don't think most normal people can evaluate studies on T cells. Like, they just can't. I can barely do it. And even I can struggle most of the time. So we're moving towards a world where you have curators and people you're going to trust to be your curator of highly complex information. And you can't use institutions as your measures anymore. It's really complicated. And one last thing I want to just put on, and Nigel alluded to this, there are very, very smart people who understand that we're in a transition phase and are using this to manipulate in national conversations. And this is stuff that I have encountered in this pandemic, that much of the misinformation is very well orchestrated, very well thought through, and spread in ways that are incredibly effective. So this is not just, my Uncle Bob shared a news story that was false. These are campaigns that are being run against, kind of science and the scientific process. And most scientists have no idea how well orchestrated it is or how to counter it. And that's been a huge problem.
Tell me more about this. Who's doing this?
Lots of people with very specific interests. So if you look at, like, for instance, a lot of the anti-vax groups, some of them have like very clear financial interests, like, don't take vaccines, they're really dangerous. Have I told you about this natural therapy that I am selling? So some people have like very obvious commercial interests, right? That's fine. I mean, it's a bit more transparent and obvious. But when I think about, for instance, the Great Barrington Declaration, with 3 leading institutional academics, those guys have had this entire strategy of trying to make sure that there are no public health restrictions, the organization behind it. And they have been spreading a ton of misinformation around, in every step of the pandemic. And so it was no surprise that they were able to get 3 academics to sign off on what was largely nonsense. And that's the problem, is that, even in the United States, we have 1 million physicians. I can come up with the kookiest idea, and I'll probably find 10 doctors who think it's worth doing. And you sign them up and you're like, this is signed by 10 doctors. How can you go against doctors? Do you not agree with doctors? Right. So so these agendas are set by people who have political, financial interests. And then you can always find a suspecting, an unsuspecting fool who will be happy to sign off on it.
It's so interesting that you say that, because on one hand, my heart is 100% with you. On the other hand, I would just remember a shock that I had about this issue in a related way. We were getting seeing a lot of the unease around vaccinations. And of course, as you know, in some jurisdictions, I want to say in France, 1/3 of healthcare professionals chose not to take the vaccine. So that's just sort of weird. I personally, just so you lay out my colors, I think that's absolutely crazy. And of course, I'm waiting, bated breath for my vaccination. But when I presented this to one of our healthcare writers at the paper, our main COVID writer, saying, many people are upset about or uneasy with the vaccine. How should we mollify that, and how should we overcome that? She said, no, you don't understand that people are right to be uneasy with the vaccine. The world has never created a vaccine on this timetable and tested it, and we don't know what all the effects are. And people should actually be really concerned. And those concerns are legitimate concerns that there might be these adverse reactions to the vaccine. Now, that really shocked me, because of course I have the knee-jerk view that of course vaccines are useful, and anyone who doesn't think so is a dunderhead. But of course, that's not quite right. She reframed it for me in a very healthy way to give greater respect, if you will, to the unease and the naysayer, and to say we in the media have a bigger job to do, to walk with them in a different way. How can we do that? Have we done a good job of that, or are the smartest guys in the room who run things just being smug?
So can I just clarify that issue, because I think I brought it up, and then I promise not to monopolize this conversation. I completely agree with your writer. I think there are a lot of people who are very thoughtful, generally pretty pro-vaccine, who are concerned. I'm not talking about that. I don't think of them as anti-vaxxers, right? I just think of them as people who are concerned about the state of the situation, and I totally get it. And everybody needs engagement. I guess what I'm talking about is these systematic campaigns that are being run in the background. And I'll give a specific example. There was a paper published in The Lancet back in May on seroprevalence of antibodies in Spain. And I wrote a Twitter thread about it. And I finished and I went off into meetings. 2 hours later, I came back and found about 2,000 responses. All of them basically essentially arguing that I was wrong, using the same set of arguments. And I remember thinking, and I started looking at who these people were, and there was like a random finance guy from Laredo, Texas, who seemed to know a lot about T-cell immunity. And then there was somebody from France who seemed to know a lot about T-cell immunity. And I thought, no, thousands of people didn't all of a sudden discover their knowledge about T-cell immunity. This is a campaign. And so that kind of misinformation very different than general like concerns about are these vaccines really as safe as we think they are. And they have become, and my point is, they have become part of the landscape. And 95% of the times, we don't see it. We don't understand it for what it is. We see it as people concerned. The guy from Laredo, Texas, maybe did a little reading on T cells. No, he didn't. It probably is a fictional account and is part of a political campaign. And we've got to understand that in a way. At least for me, that's been my big revelation in the pandemic. I didn't realize how systematic this stuff was. Let me stop. I've gone too long.
I'm tempted. On one hand, I wonder if we shouldn't move on. On the other hand, I find this to be so interesting, and I don't know about it, that I do want to dig a little more into it. But of course, Ashish, you've been speaking a lot, and so let me first turn to Nigel and Alex and ask both of you: have you witnessed this as well? And let's take a second and think about this, because it does seem fairly essential. Other than the people who are trying to sell an herbal remedy, and I will say the U.S. intelligence agencies have said that they have witnessed, they've seen misinformation, deliberate misinformation by China and Russia in the American information commons that have been anti-vax. Okay, so we can all sort of imagine why China and Russia would just want to sort of sow discord, or not. Actually, I don't think institutionally they want to. I think that certain pockets of their government would do that just because they have a remit of doing that to an adversary that they perceive America to be. But aside from that, which I think is cognitively comprehensible, why you've got self-interest on the one side and a state actor just sowing malevolence, teasing court jester-like malevolence on the other. Why is there a systematic misinformation campaign? Who's behind it, and what are their interests?
Well,
go on, Nigel.
I'm not sure I know the answer. I'm not part of the conspiracy. I think there's various things going on here. I think the point that we started on, which is actually there is some genuine reason for people to be anxious and to want to understand what's going on, and that there's in some cases a quite legitimate reason why people might want to be skeptical. But I think that is on a different league from some of the different disinformation you see. And while I think one can explain some of this from that institutional thing, I think that it may reflect more a desire for people, a sort of anxiety that people have, and a wish to see normality, and a belief that things are not as bad as they're being told, and people are perhaps responding to some of this in ways that are sort of look irrational to us, but to them seem very rational. And then, in other words, they're not hearing a story from everyone else around them that chimes with the way that they think the world is working. And I think that is a slight problem with Alex's sort of higher level of optimism than mine about the extent to which we can rely on the good common sense of the British people, who I have to say on a number of quite significant issues have not distinguished themselves.
I think you're doing us down still, Nigel.
Boat team at Boatface.
I think that's a brilliant name.
Yeah.
But anyway, yeah. So I like to look at things by trying to understand where other people are coming from. And one of the things that I've really got my head around is how much of people's reactions to information is based on trust and their different trust relationships. And when we ask people throughout this pandemic, we've been asking people, how much do you trust various things and why? And they get to write in the free text box. And I've been reading tens of thousands of responses from 13 countries about why people trust different sources of information the way they do. And I mean, it's fascinating because so often they talk about the motivation of the communicator. So they say, oh, I don't trust what these newspapers are saying because they're trying to sell a news story. So they've got a motivation to make things sound more dramatic. Or I do trust my friends and family because they've only got my best interests at heart. So there's quite a lot about, they do also say, things about credibility, whether they've heard the same information before in lots of different places. And sometimes about whether it just makes sense, whether it fits with their understanding of the world. So people are really making quite sophisticated, nuanced judgments every time they read a piece of information about how much to weigh it. But I think that trust element is really interesting, because if you do thought experiments about swapping your trusted sort of values with those of someone else, that helps you see it. So imagine somebody had come to you with the Russian vaccine. Would you have a different reaction to taking the Russian vaccine to taking the Pfizer vaccine? What about a North Korean vaccine? You know, suddenly you are seeing it from the point of view of somebody who now doesn't necessarily trust the person who's developed it to be open about the information about side effects or effectiveness. So if you then put yourself in the perspective of somebody who doesn't trust Pfizer or Oxford University or AstraZeneca or any of the companies that are providing this information, then you can see why they have hesitancy about taking that vaccine and taking it on trust. And so I think these thought experiments about putting yourself in somebody else's perspective, what if you didn't trust that institution? What if you didn't trust that person? And there are perfectly valid reasons why they might not trust those institutions, just as there are perfectly valid reasons why you might not trust the ones that you don't trust. So I find those really helpful.
Let me take the issue of deliberate misinformation online. Let's park it off to the side. And look at that issue of trust, because it is so foundational. Hearing you speak, I pose the question to myself, amid this pandemic, will the public's trust in government increase or decrease?
I can tell you what it's done at the moment.
What's that?
I can tell you what it's done at the moment. We've seen it nosedive.
Why?
Trust in government. Well, I don't know why, but it has. You know, every time we ask them, how much do you trust the government to deal with the pandemic, it's gone down.
Now that's Britain. What about in the rest of Europe? What is it in America? What about China? Do you have any idea of public opinion there?
I don't, no.
Well, that's okay. So anecdotally, I'd be interested. Ashish, why don't you come in? In America, I presume that on January 19th, 50% of the country didn't trust government. And on January 21st, 50% of the country didn't trust government. But tell me if I'm wrong.
You're not wrong, but the numbers are a little different. Late December polling, if I remember, but definitely under, let's say when President Trump was still in office, about 40% of Americans, 40% of Americans thought he was doing a good job on the pandemic. So you have to understand that a lot of people voted for him, despite the fact that they felt that he was doing a terrible job on the pandemic. And currently, if I remember correctly, President Biden's approval on the pandemic is more like 65, 70%. But if he were to run for election today, he would not get 65% of the vote, right? So there's a little bit of with Donald Trump particularly, there's been a long kind of standing, which I think gets at a really interesting question, by the way, which I think it relates to what Alex has been saying, which is a lot of people who think he's done a terrible job as president. He was awful. Would you vote for him again? Absolutely. And that's a sizable proportion of people. And we need to somehow understand that, because if somebody begins with, has he done a terrible job? Yeah, he's done a terrible job. My assumption is you're not going to vote for him again. But that's not how it has played out. I mean, the election was exceedingly close because lots of people thought he was doing a terrible job, but wanted to vote for him because of a sense of identity of he may be a bad president, but he's my president. He represents me, and that's important. So identity really does play a very important role.
So let's think about trust and evidence and the role of the expert and the communication of the evidence and the vehicle of the state. This was an opportunity for the state, which was mistrust before COVID, to actually rebuild trust by showing competence. And I think if you were a New Zealand citizen who was uneasy with government before, a lot of that's probably evaporated because you saw Jacinda Ardern sort of take a strong stance early on and save the country, the worst of what had befell Italy or Britain or America and elsewhere. So trust is probably enhanced. In China, I think a lot of citizens probably in this domain probably trust the government. It seems like it reacted well. In Britain, it's gone down, as Alex has showed us. What do you think that governments can do to use this as a moment to rebuild trust? And after I hear from you, we're going to go to questions from the audience. And if audience members have other questions, they should use the chat function, because we're going to be turning to you now for your questions. Who wants to take a stab at what governments can do to rebuild trust through the use of evidence?
I think they need to be trustworthy. You know, so often people come and say, how do I get people to trust me more? And actually being trustworthy, which is being open about uncertainties and being open about difficult choices and explaining why choices are being made, and, you know, just being more trustworthy and open about the evidence and how you're reacting to it and why you're reacting to it in the way you are, I think builds trust.
I think one of the difficulties that the UK government has had during the pandemic, it started with only on international terms down the league table of trust. So it started at 45% of people having high levels in trust. I think what people have witnessed is changing their mind. Of apparently listening to the evidence and then not acting on it. It's complicated by the fact, of course, we have 4 different governments. So actually, we've also seen different governments apparently reacting in different ways on the same evidence, which I think has probably not been entirely helpful. And I think a sort of the what's I think called boosterism, you know, the constant claiming that we're about to reach the sunlit uplands, everything's about to be all right, and then that not being delivered very evidently very, very quickly. In the case of schools opening within 24 hours last time, I think that's that really chimes with what Alex is saying there, is that you know, people get discontented and fed up, and revolutions happen not when things are at their worst, but when people's expectations are not met, where the gap between what they've been promised and what they get is at its greatest. Things tend to fall apart, and we've had too many examples, I think, over the last year of that, having framed a set of promises and objectives and then not delivering on them, and being very clearly at odds with each other. So within government, between governments in the UK, and between the scientists and the government as well. So not doing that is basically is part of the equation, I think.
Great. Ashish, I want to ask you about trust in government. If you want to come back on this as well, or do you think that your first answer sort of?
No, I don't know that I have that much more to offer. I do think it's difficult for government, a lot of government leaders in the United States, and I said, in my sense is also in the UK, to convey uncertainty, to say that they were wrong about things. And I mean, obviously, the worst offender of those things was Donald Trump, who was pretty consistently wrong on everything, but couldn't admit any error. But you know, it's just that's a challenge of political leadership that I think may instill confidence under certain circumstances, but in something like a pandemic where there is so much unknown, where you're so likely, even under the best of circumstances, to get stuff wrong, it's not a very good way to do leadership.
But it gets back to the complexity issue. If you talk about the uncertainty, can the public understand the uncertainty? Before we go to questions, let's drill into this for a quick second, which is that at the outset of the pandemic in the United States, America's public health officials said that masks wouldn't work to prevent COVID. All the healthcare professionals told me actually they would. And so you had this weird environment in which they were deliberately miscommunicating the reality, the situation, the truth, the complexity, because they didn't want to run on masks that could be used by medical professionals. It seems to, and this item has been trotted out again and again and again by people who want to sow mistrust in government, like this sort of endless broken record. But of course, the healthcare authorities, even Fauci, they've tried to apologize for the simplification that they made. White lie is what we also might refer to it. That hasn't landed quite well, as opposed to the talking point by those who want to just simply stir discord by saying that you can't trust the system. What do we do?
Yeah, I'm sorry. Go ahead, Alex.
Well, I was just going to say that I think here in the UK, Professor John Krebs had a very good way of talking about uncertainty in a crisis, which is, he said, tell people what you know, tell people what you don't know, tell people what you're doing to find out, tell them how long it's going to take and when you're going to come back and tell them an update, and tell them what they should do in the meantime to be on the safe side. And to me, you can't beat that as a piece of advice. And if everybody just ticked off that list in their communication, I don't think we'd be in the place we are now.
The other part I would say is throughout this pandemic, as new information has come in or questions have come up, what I think I've tried to do certainly is also just share judgment. Like, for instance, when the vaccines first came out and we saw good data on efficacy, people said, well, are they going to cut transmission? Because if they don't cut transmission, then obviously there's a huge set of problems. And a whole bunch of public health people said, we have no idea. We should assume they're not going to cut transmission. And if you do the mental model of they're not going to cut transmission, then it has this huge effect on how long the pandemic will last, what's going to be safe when. And what I think a few of us try to do is say, look, vaccines generally cut transmission. This will probably cut transmission. Do we know for sure? We don't. We're going to figure it out. But I think we should have a mental model that says it's probably going to happen. And let's spend some time sorting out how much. And if we're wrong, we'll let you know as soon as we figure it out. No one's saying we're sure. But I think that's uncertainty. That's complexity. People handle that just fine.
Okay, this is so interesting. Let's now, Mark Diane of the Nuffield Trust, tell us, you've been collecting lots of different questions from people.
I have.
Give us maybe one or two of the most interesting, and then if you can sort of if you make agglomerations of them, if it's around the same vicinity, tell us what they are. But I think instead of giving us maybe, unless there's one that you want to tell us, maybe give us 1, 2, or 3, and then we'll tussle with them.
Well, yeah, we've had loads of really good questions, so apologies if we don't get to any. I'll start off with a couple and then, as you say, merge some that have come together. So 2 that I think we can get started with, triggered by different parts of our discussion. Well, let's go for 3. Tamara Wildwing from Canterbury Christchurch University poses a question to you, Alex, says, is Alex right to suggest doctors should not be persuading patients? Maybe that is or isn't what you've said. Shouldn't doctors be giving patients more than informed choice, persuading them to do what the doctor as expert thinks is the right decision? And then sparked off by, I think, something that you said, Kenneth, James Mountford of NHS England asked if you think that there are campaigns or themes behind some of the perhaps misinformation you've seen, taking the Great Barrington example, all those people signing up to a letter post lockdowns. What was the agenda behind it? Presumably not a single thing, but something united them. What do you think that was? And then just lastly, we've had a couple of different questions from Alison Turner from the strategy units and others about what could we do if we want the public to do more in taking health choices and decisions to improve health literacy, to better position them to understand and take those sorts of decisions correctly?
Those are great questions. Keep them coming for the people who are watching. And Mark, please create a great list for us, because what I'd like to do very quickly, we've got about 12 minutes left. Let's hear from some of the panelists now on them, and let's come back to you, and we'll use that as a way of summing up for the session. So we'll try to come back to questions as well. But that gives us quite a lot to do in terms of what to do to improve health literacy, in terms of what's the role of doctors, should they be persuading or giving just choices, and what is the agenda behind the misinformation. Alex, Nigel, and Ashish, who wants to go first? Who's chomping at the bit?
Well, shall I start with the one directed specifically at me? So doctors and informed consent. So in the UK, the legal basis of informed consent is that the patient, if they have capacity, gets to make the decision, and they should be offered the option of a shared decision-making process. So they should be informed and not persuaded, but the patient has the right to ask the doctor what their opinion is, and to go with the doctor's opinion. But the basis of informed consent is that it's the patient's choice, and the doctor shouldn't be persuading them to take one course of action over the other. Where it gets into public health, that's a much more nuanced debate about how much, if other people's health is at stake, informed consent and individual choice should be allowed. And in the UK, we don't have mandating of vaccines, but in some countries they do. So that's a much more interesting debate that we don't have time for.
On the health and numerical literacy point, I see Andy McKeon, as one of his questions in the box, it also points out that this has been a point in history where government has probably given more information about what's happening than at any point in living memory. We've all been bombarded with our numbers, and we even all now understand log scales, apparently. So in a sense, we have started to provide the information for the public to start actually understanding it. And it's interesting, isn't it, that when the public are asked about lockdowns, for example, they tended to take a rather more conservative with a small c view than the government. They want to see stricter measures with more enforcement. And in fact, have become quite impatient at it took a year for us to deal with people arriving by air. We still haven't dealt with the issue of financial protection for people who are forced to self-isolate. The public get that. So actually, the public have done quite a good job in many ways of drawing conclusions. I mean, I think certainly overall, if there's one thing we've learned from international comparisons, we can certainly do with improving the numerical and scientific literacy of the population generally. And I think there's more proactively that can be done to deal with some of the disinformation that comes out on social media. But we perhaps shouldn't be too pessimistic about this, given the public's response to this. But in this country and in others, the public has behaved much more sensibly and in a public health way than one might have expected, and that many of the pessimists, the Conservative Party have had a 200-year fear of the mob since they haven't really got over 1789, one could kind of see that in some of the calculations that they appeared to be doing in the first part of the pandemic. I think there's maybe reasons to be a little bit more optimistic on that point.
Let me add a couple of things, and picking up on the point that Alex was making around, and the question around, do you just provide information or do you provide guidance? So government and what government can do, obviously there's some very specific policy issues. In my mind, what I have found most powerful as a communicator in this pandemic has been to lay out the evidence and then talk about my personal choices and my family's personal choices as a way to signal how I come down and where I think people should come down. So people, in the beginning when the new data were coming out on vaccines, and people said, do you think these vaccines are trustworthy? I'm like, here's the data. And then I said, I will get it as soon as I can. I will have my elderly parents get vaccinated. And I have no better way to argue, this is what you ought to do. I don't know if I've ever said to people, you should or not. I say, here's what I do. Here's what I recommend to my family, my parents, my children. It's a way of signaling judgment without beating people over the head with the judgment issue. And without being paternalistic and saying, you have to do this, or you absolutely must do this. I think finding ways of connecting with people in those ways is really important. I think the other part around this is, the pandemic, you can have policies, and policies often lag human behavior. And this is, I think, what Nigel was saying as well, is that we saw, for instance, when outbreaks happened, yes, we shut down restaurants, but often well after people had stopped going to restaurants. People started voting with their feet before the policymakers stepped in. And so if you really are going to control pandemics, you actually need to get people to vote with their feet. You need to inform them and help them make better choices. And that is not just a job of government or public health officials, but it's other trusted voices. And I think this is something we have not done enough of, is engaging civil society leaders, religious leaders, other people that people trust, and having them be part of that message campaign. I just think we didn't do enough of that in this pandemic, and that's something we need to do better in future health crises.
Really interesting. I know I've got two questions in the back of my mind that I want to just sort of fling out to the panelists before we end, but I did want to go back to Mark and see if there's any one question that really seems quite apropos that we can bring to all the panelists before I ask my final wrap-up question. Mark.
Yeah, so we've had a lot of interest in this question about persuasion and explanation, and I'm going to pull out two that are kind of related. Jessica Morris from the Nuffield Trust has asked about what we think the ability of experts is to clearly describe risk to patients and the public, whether that's about anti-vaxxers on a national scale or GPs choosing between treatments. And Minesh Kashu is a professor of public health, has also asked a kind of related question, sort of flipping this round a bit, to ask, really, is overly complex information the problem? If an expert understands things well, as Einstein says, shouldn't they be able to explain it to a 10-year-old if they truly understand it? So do they really understand if they can't explain complex information, and are they able to communicate risk to the public?
Okay, good. The ability of experts. Sometimes I would even wonder if we're asking too much of them. I mean, they're experts after all. Why should they be able to be good communicators? Maybe that's someone else's role. Why don't you guys try to take a stab at that?
Well, I mean, this is what we do in our day job at the Winton Centre, is to try and help people communicate risk. And it is a really difficult thing, and it's not just about numbers. So you have to understand, you know, a risk isn't a number. It encompasses all your feelings about that risk and your particular personal vulnerability to that risk. You know, I'm not afraid of having to take 2 days off work if I get sick. For other people, that's 2 days of caring responsibility or 2 days of income or whatever. So it's a very personal thing, your feeling of risk. And I think for professionals who have to communicate risk on an individual basis to people, it's incredibly complicated, and I think they need a lot more help than they get at the moment. So yeah, I think it's a big ask, and I that's why I say I think it's one of those areas which is only just becoming part of the curriculum of the sorts of people who need to learn how to do it.
I just will add that there's no reason to think that somebody who's a fabulous epidemiological modeler knows how to communicate risks in a succinct and effective way. We have to do two things. I mean, we just understand that a lot of scientists won't be effective communicators. That's fine. That's not why we needed them to be scientists. But also, we do need to train people to do this. I mean, one of the things that's often been the case, and this is why I think places like the Winton Center are so important, is we've had this idea that they're just naturally gifted people. I mean, there's some naturally gifted people, but almost everybody could get better, and we probably should have a broader group of people who've gotten formal training in how to do more effective communication, because it will make us better off as a society.
I'm left with the overall impression, Kenneth, that we're perhaps expecting a bit too much of our experts, and that there's a broader both political and societal obligation. There's an interesting question asked at the recent Institute for Government lecture about, well, how should we hold experts accountable for what they're saying? And it seems to me that comes from a framework which still believes that experts have got all the answers. And I think Alex's framing of how people think about risk actually shows that it's way more complex than that. There are so many difficult trade-offs, and that probably means that, while it pains me to say it, we may need to give some of our politicians a break on this, but probably only some of them. I am very struck by an article, I think I can't remember where I saw it, comparing the behaviour of populist governments with more conventional ones, and drawing a distinct conclusion that populist governments are more dangerous for their population in the COVID-19 era than the more conventional democracies. There are some confounders in that, which is it's also the case that governments run by women seem to have done better. So who knows how all of this works? But certainly, I think an easy populism is probably not what we needed. But it's all much more complicated than we think. But I'm left with the optimistic conclusion, listening to Ashish and Alex, that it could also be so much better explained, and we probably ought to have more faith in the recipients of it than we have had in the past.
So that is a nice note to end on. Now, I began the session by asking you all to come up with one word and a one-word answer. And Ashish tried to sort of filibuster, but I brought him back. And he did so well that I'm going to try to end in the last 1 minute that we have, similarly by asking you to give a grade. And I'd like you to grade the use of evidence in responding to COVID-19, not how governments have responded to COVID-19, but how the use of evidence. And of course, it's a tricky issue. So you can't just say, you can't do it on 1 to 10. I want an A, B, C, D, or E, or F, I guess, A, B, C, D, or F. And we know that they wouldn't have been perfect. So that can't be the standard. But generally, the use of evidence, how was it? Ashish, you, how do you grade it?
A B.
Okay, Nigel.
A B.
Alex.
Worldwide, B plus.
I think you all are just way too diplomatic, but we will have to unpack those things.
It's not, it's the use, it's how it's the decisions have been taken, I think, rather than how it's been used. But yeah, excellent.
And different in different countries.
Yeah.
There has been a lot of good information if you want to find it.
Yeah.
There has been a lot of bad information that you can't avoid finding when you're in the Commons. So look, everyone, thank you very much. I want to thank all the attendees for listening. I want to thank Professor Ashish Jha from Brown University, Dr. Alex Freeman from the University of Cambridge, and also Nigel Edwards from the Nuffield Trust. I want to tell you in terms of misinformation that it is not true. It is not true that the Nuffield Trust is changing its name to Nuffield Face McFace Trust Face. That it's still going to be called the Nuffield Trust. And I want to thank everyone for listening. Thank you very much.